Bismillahirrahmanirrahim. Puberty. What is puberty? A transitional period of development where the non-reproductive individual become reproductive. So, a couple of changes occurs in this non-reproductive individual and to become a reproductive individual. So here is a definition. It is a transitional period of development during which non-reproductive individual become. What are changes occur during this transitional period of development? So number one is the maturation of primary sexual characteristic, in which what is happening. So the immature, the hypothalamus pituitary ovarian axis become mature. So this is number one. Number two is the development of secondary sexual characteristic. Secondary sexual characteristic. What are the secondary sexual characteristic? Sexual hair, pubic hair, and the axillary hair. Okay, and the breast development and the genitalia development. So certain changes occur in the breast, so and in the genitalia. So in the sexual hair, you see in the reproductive age. Okay, and here in the axillary hair and the breast development. Okay, and then number third is the dramatic growth spurt. There is growth changes. So there is increase in skeletal growth rate. The height is going to increase, and there is muscle mass is going to increase, and the growth of all the internal organ. Okay, so this is third change during this period. Okay, here you can see the muscle mass, and you can see the difference in the adult. Okay, and you can see the size of the clothes, so they are going to increase. So increase in the height, increase in the muscle mass, increase in the all internal organ. And number four is the psychological changes. Psychological changes mean the individual becoming the emotionally and the mentally mature. Okay, so these are four changes: the maturation of primary sexual characteristic, HPO axis maturation; secondary means sexual hair, breast, genitalia, and the growth spurt. This increase in skeletal growth, muscle mass, and the growth of all internal organ. Let's see the HPO axis hypothalamus, inferior pituitary, and the ovary, and there is the endometrium and the uterus. So there are changes occurring in this axis. Okay, so hypothalamus release the GnRH, which act on the inferior pituitary, which release the FSH and the LH for the ovary. So they act on the ovary. Okay, so which release the estrogen and progesterone, which act on the endometrium. So there are growth in the endometrium. That's why, and there is shed of the endometrium that lead to the menstruation. If you see this picture, what is happening here is the ovary, which release the ova, and this is going to implant over the endometrium. Okay, so there are some changes occurring in the ovary due to action of FSH and the LH, and some changes occurring in the endometrium due to action of the estrogen and the progesterone. Okay, so follicular phase and the ovulatory phase, F, which is FSH act on the follicular phase, and the LH act on the ovulatory phase. So in the endometrium, you know better, there is a proliferative phase and the secretory phase, and the estrogen act on the proliferative phase, and the progesterone act on the secretory phase. So these are action of the HPO axis. Here you can see the endometrium, which is growing by the action of this HPO axis. So after each month, so there the shed of this endometrium layers. So that's why there is a bleeding. Okay, so maturation start. This was the HPO axis. Let's see the maturation of HPO axis during the childhood. So the HPO axis is the immature, and there is some CNS inhibition via the GABA. So that's why decrease in the GnRH and decrease in the FSH and LH. So during childhood, FSH and LH are low. After the 8 or 10 year, so what is happening? So there is early maturation of HPO axis, where you see the pulsatile increase in the GnRH, but it's limited to the sleep cycle. So only during the sleep, so then this GnRH is released. Okay, it's early maturation. But during the menarche, when there is maturation start, so the HPO axis become completely mature, and there is a release of GnRH all the time, not only limited to the sleep. So here you can see, so this is childhood, the after 8, and here is the menarche. If you look at the childhood, so you can see the level of the LH here you can see is very low. So same for the FSH. Okay, so FSH and LH are low, less than 4. You can see at this stage what is happening. So you can see here is the sleep stage. So you can see the increase in the FSH and LH during the sleep time. Okay, after that there is low. If you look at the menarche, so it's a continuously release of the GnRH. So these are changes occurring in the HPO axis. Okay, so after the birth. Before birth, what is happening? If you look at the before birth, at the 5 month of gestation, so HPO start responding to the estrogen, so it get the negative feedback by the estrogen. So where is this estrogen? This is actually coming from the fetoplacental. Okay, so there is fetoplacental estrogen, so which give a negative feedback. So that's why GnRH and the FSH LH are low during the utero. Although it's a functional HPO axis, so but it is low due to this fetoplacental estrogen negative feedback. So after the birth, because the placenta is removed, so the baby is disconnected from the mother. So there is a dramatic decrease in the estrogen. So that's why which lead to increase in the FSH and LH, and which stimulate the ovary, so which increase the estrogen. So that's why there is sometimes physiological bleeding. Okay, because this estrogen act on the endometrium, which increase its thickness. So that lead to the bleeding. So some child may experience the physiological bleeding at birth. So this is normal. Okay, due to dramatic decrease in the estrogen. So after in the first 2 years, so this FSH LH is high due to sex steroid. But after that, before 6 to 8 years, the CNS inhibition continues where the GABA and GnRH and FSH and LH are. In this picture, you can see initially there is somehow the FSH LH is released, but later on it become decreased due to negative feedback. Okay, so it's continue low until the maturity. At the menarche. So then it's going to increase. Okay, what are other changes during the puberty? So these are usually occur in the 11 to 12 year, which is mean age for the other changes. Okay, so let's see the sequence. So sequence start from the growth part, where muscle growth is occurring and the skeletal growth is occurring and the internal organ growth is occurring. Okay, so and the HPO axis maturation is also happen during this phase. Okay, and this is occur with the help of the growth hormone and the androgen. So this growth hormone and androgen, so they actually increase the muscle mass and the skeletal development and the internal organ growth. Okay, so it's if you look at the age range 8 to 14 year, and usually start from the 8. Okay, and there is 6 to 8 centimeter growth per year, and a 2.5 year duration for this growth. Okay, you usually see. Next change is the hierarchy. So where the breast development occur, it follow the tenor stage 1 to 5. Okay, so age is 8 to 13 year, mean is the 11. So and it's under the action of estrogen. So for the development of breast, estrogen is required. Okay, so if there is no estrogen, there is no breast development. Here is a tenor staging 1 to 5. So this is stage 1 where there is no breast development, or the pre-puberty stage, and this is the adult stage where the complete the breast is developed. Okay, so these are the mid stages. So initially start from here, then the further growth and the further growth. So here you can see also in the later view. Okay, so this is the pre-puberty. Here is the adult stage. Okay. The next event is puberty or adrenarche, means sexual hair growth of the pubis. Okay, so here you can see there is no hair growth, and here is the adult hair growth. So initially start the slight hair, which become darker, and there is a curly hair, and it's there is spread of these hair toward the medial thigh. Okay, so it's the stages, tenor stages. Okay, and it's usually occur between 8 and 12 years. okay, and dependent upon the androgen. So dihydroepiandrogen and the dihydroepiandrogen sulfate. So they are dependent upon this. So this actually present in the male and female both. So which is responsible for the hair growth. Okay, and in the menarche, so maturation, which is start from 12 to 14 years. Okay, so and it's associated with the pulsatile GnRH. You know better at the menarche. So there is secretion of pulsatile GnRH, which cause the FSH and LH, which impact on the ovary, which affect the release of the estrogen and the progesterone, cause the endometrial changes, which cause the maturation. Okay, and the axillary, where you see the mature sexual hair in the axilla. Okay, there is also been observed if there is a low subcutaneous fat, so there is no start of the menstruation, or the patient come with the complaint of the primary amenorrhea. So she said all the other friends of same age, they started the menstruation while she has not. So what is the problem? So sometimes it's due to the low fat deposition on the subcutaneous fat. So for the menstruation, almost 17% to maturate. For the ovulation, 22% is needed. If you look at the tenor stages closely, so if you say in the first is pre-puberty, no growth, while in the second stage there is small mound, only small mound. Okay, and in the third stage, you see the further enlargement of the breast, but there is no difference between the breast and the areola. No difference in the breast and the areola. So in the fourth stage, there is a differentiation between the areolar and the papilla. Okay, so when you see the differentiated, it's a fourth stage, and this is the full stage, the final stage, where the adult stage has been achieved. If you look at the pubic hair, there is no pubic hair. Okay, no pubic hair. While in this condition, all the pubic hair has been grown, and they are reaching toward the medial thigh also. Okay, while in the first condition there are few hair, you can say countable hairs, while in this condition there are the number has been increased, also they become darker. So here are they are lightly and they become darker, and in this condition some curly hair also start, and while in this condition it's reaches to the medial surface of thigh. Okay, so these are tenor stages of the development. Okay, here you can see the onset of puberty by the ages. So 7, 8, 9, 10, 11. So breast development, the pubic hair development, where you see the maximum near about the 11-year old. So when it reaches the 11, 91% girls achieve the breast development, and 86% achieve the pubic hair development. Okay, so here you can see the height. If you look at here, so at the 11 to 13, so they have a maximum height, but after the 14 almost, when the menstruation start, so there is no further height growth. Okay, after the menarche, the female have no the height growth after the menarche usually. Okay, somehow, but if you, in this picture you can also see the 12 to 14-year-old. So after menarche, some height is going to increase. After that, there is no further growth in the height. Okay, here you can see the shoe size, so which is also reaching to maximum level at the 10 to 12-year old. Okay, so here also you can see the peak increase in the 12 to 10, 11, 12. So 10, 11, 12, 13. So these are the stages of peak development. Okay, in the female. Some key points you must recall. So the FSH and LH before 10-year-old is increasing. So that's increase the estrogen, which cause the secondary sexual character development. Okay, and estrogen level high do what? Development of secondary sexual characteristic. Okay, and also skeletal growth at low level of the estrogen. Okay, and the also increase the growth hormone and the insulin like growth factor. Okay, so which also increase your the skeletal muscle and the other body mass. Okay, and the androgen which increase in androgen which cause the sexual hair growth. Okay, and important thing you should note is the next new point, which is adipose tissue provide the leptin. So leptin also play a role in the puberty. So for example, CNS, in the CNS they regulate the eating behavior and the energy balance, and the high leptin induce the early menarche. So if there is high adipose tissue and there is a high leptin which induce the early menarche. So that's when there is low fat, there is low leptin, so there is late onset of the menarche. Okay, so after the tenor stage, as the tenor stage is in advances 1 to 5, so leptin level going to decrease, which also increase the food intake. If you look at the genital organs, so they are also increasing in their size structure. So if you look at uterus, there it's becoming large, and the ratio of uterus and cervix have become 2 and 1, when uterus become 2 times as compared to the cervix. And the vagina, so it's also the length of vagina is increasing, and its thickness, the epithelium become stratified squamous and filled with the glycogen. Okay, and so it's the pH which is initially neutral and now become the acidic. If you look at the ovaries are also increasing in their size and changing their shape, and shape become almond. Okay, almond shape. Okay, and if you look at the number of primary follicle, which is 2 million at birth, now only the remaining number is 300,000. Okay, at the start of the menarche. And if you look at the external genitalia, mons pubis and the labia majora and minora, so they're also increasing in size. So these are structures you can see uterus and the cervix. So size of uterus is almost 2 times as compared to the cervix. Okay. And the vagina also the length is also increasing, and here is the acidic pH. And if you look at the ovaries, so it's just look like the almond. Okay, so almond like ovaries. And in summary, uterus, ovaries all are increasing in size, and vagina is becoming more thick, and the external genitalia also increasing in. Here is the chart of comparison before puberty and after puberty of the uterus, ovaries, and the vagina and the external genitalia. You can read on your own self. Okay, thank you very much. Allah Hafiz.